Good day, dear students. In current previous hours, we talk a lot about bacteria, mainly about microorganisms. We talk about their properties, about their structure, composition, how to identify bacteria, how to cultivate it. We talk a lot about uh, different staining techniques, microscopic views, and of course, we already know that bacteria is highly prevalent in the environment. They can be found in water, in air, and even in our tissues, in our skin and other tissues. We have wide range of different bacteria, which is known as microflora. And it is fine to have that bacteria while it's located on its place. And of course, we already said that if that bacteria will shift to other locuses, or if host became immunocompromised, means immune system became weakened, then even that normal flora bacteria can cause some infections and some diseases. And of course, you're all going to be a doctors, you will work in hospitals, in different hospital settings. And of course, you should understand that, especially during some invasive procedures, during surgical manipulations and surgical procedures, it is always a high chance that bacteria from skin of the subject, from skin of the hospital staff, can invade in the wound, in a punctured wound with a needle or in surgical wound. And of course, if that bacteria will shift to new location, here it will not be normal flora. It can cause serious infections and serious diseases. And of course, medical staff is a regular human. We all have bacteria in our skin, and that bacteria can easily cause serious infections in our subjects. So the purpose of current lecture is to talk how to prevent infection originate from our own flora in subject and patients in hospitals, in ambulance settings, in outpatient departments. And if that infection anyway occurred, how to treat and how to cure that infection to make our patient safe or and healthy. And of course, in medical practice, in general medical practice worldwide, regardless of geographic location, we have several key definitions, several key ideas. We need to talk first of all. So on the first few slides, we will only discuss definitions, and then we will talk about methods, how to perform those techniques. So first of all, of course, we need to talk about sterilization. And sterilization in medical practice refers to complete removal of all living forms, either in vegetative or spore state. And the key thing here, even spores should be removed. Everything uh, alive or able to give a rise for a life form should be removed. And of course, we will talk about bacteria, fungi, protozoa, viruses, everything should be micro. Say that instrument is sterile or some, some medical device is sterile. So again, sterilization is complete removal of all living forms, either in vegetative or spore state. Second idea is idea of disinfection. Disinfection, as it is obvious from the name, it is destruction or removal of all pathogenic organisms capable of giving rise to infection. And the major difference here is non-pathogenic microorganisms can remain alive. It's not complete removal as in previous sterilization idea. Disinfection, it is only removal of infection, disinfection. And of course, that measure is more soft. Usually it is refers to washing floors with some specific solutions, cleaning walls, and general measures to prevent only infection. But some harmless microorganisms can remain alive, it is fine. If it is disinfection, it is allowed. Uh, Third and the most radical measure, it is decontamination. Decontamination, it is eliminating of contaminants, including microbial, chemical, radioactive, and or other hazards. Means you should remove everything potentially dangerous to human. And if you like to watch movies about some worldwide disasters, when some explosion, secret laboratory occurred, or some aliens drop some unknown substance on our planet, it is always quarantine, usually made by army, and it is always decontamination procedure for every person who is entering or leaving the area of that quarantine. Specific suits, everyone is in protective suits. People with some detectors are standing and checking radiation and other hazards. That measure is known as decontamination. It is elimination of contaminants, including microbial, chemical, radioactive, and or other hazards. It is again the most radical measure when potential hazard is unknown, when something happened but no one is sure what is exactly happened. And in that way, of course, you need to remove everything. Or when several explosions or several disasters occurred and you have multiple risks in some area. And usually that measure is, of course, expensive. Multiple different expensive devices are required, solutions and other. And that measure is usually provided by government, but not by hospital or some other small facilities. Uh, and the most common measure, it is antisepsis. Antisepsis, it is prevention of infection by inhibiting the growth of microorganisms in wounds or tissues. So antisepsis is prevention of infection. Mainly it refers to some biological tissues. And you should inhibit the growth of microorganisms in already existing wound or in tissue intact till the moment, but maybe tissue where you are going to perform some incision, injection, or other. It is antisepsis. Of course, it is most popular measure in medical practice, and to perform antisepsis, you will require antiseptics. Antiseptic, it is a chemical used for safe application on skin or mucous membranes to prevent infection by acting on microorganisms. So antiseptics should be dangerous for microorganisms but safe for animal tissues. We should be able to apply it safely on intact skin, already injured skin, and those antiseptics should not harm us. And of course, that measure is always performed in surgery and before any injection, before obtaining of blood samples, any. And antiseptics, which are used in medical practice, can be of two types. Bactericidal, it is a group of antiseptics, group of chemicals which can kill bacteria immediately. And we have bacteriostatic antiseptics. It is a group of antiseptics which can prevent multiplication of bacteria. Means bacteria will not die immediately, but it cannot multiply. And of course, it has some duration of life, and after that time period, bacteria will die. Bacteriostatic antiseptics require more longer time period to eradicate bacteria. Bactericidal are more effective right now, but usually bacteriostatic antiseptics more safe. They are less dangerous, less aggressive. Bactericidal are more active chemically in chemical manner. So now we need to talk about different methods and options how to perform procedures of sterilization or disinfection. So mainly we will talk about sterilization because disinfection is very limited and soft type of sterilization. So let's discuss first of all sterilization procedures which are used in medical practice. First one, it is shown in the slide and the picture. Of course, you're all familiar with the spirit lamp, and you all will perform that technique during classes in laboratory in our department. It is a group of physical methods with the use of high temperature. and that method using dry heat. It is flaming. Flaming, it is a procedure when you need to put something into the flame. Usually we will use metal substances, metal instruments, until that instrument will become red hot. So in our classes in laboratory, we will use bacteriological loop and forceps, and they can be easily sterilized with the help of the flaming. So any method of sterilization have some benefits and some penalties. Of course, the main benefit of flaming, it is very simple and easy available. It is a simple alcohol, very cheap, glass uh, lamp, and actually that's all. Of course, it is cheap, easy available, it is easy to use it in any part of the room laboratory. You don't need some power outlet or other things. And of course, method is very fast. But the main penalty of that method, it is using direct flame. And of course, that flame will heat instrument immediately and very fast with the help of high temperature. And if instrument is made of uh, multiple metals, they can have different they can enlarge in different manner during heating, and complex metals can break. So usually that method is used only for single metal made instruments such as a loop. And of course, one more penalty is uh, putting something into the flame uh, will easily change the surface of that instrument. It will become black. Some flaming and heating waste will stick to that instrument. It will become black, and actually you cannot use it for some invasive procedures. It is only some instruments to take other instruments, for example, or to deal with non-sterile instruments and non-sterile things such as a bacteria. Of course, you cannot sterilize some lancet with the help of that technique, because that black sediment on the surface will not allow you to perform any invasive procedure. But in laboratory, that method is very simple and easy, because if you take bacteria, it's fine if you will have some waste product of flaming in loop. It's not a problem at all. But again, use of that method is very limited only to laboratory practice and only to some primitive and simple instruments. So second method is incineration. Incineration in simple language is burning. It is a method you can use only once. Usually incineration is used for biological tissues after surgery, for clothes, bandages, for example, um, with blood or some other liquids, and some single-use plastic instruments. Of course, after incineration, the instrument or cloth or that tissue will be completely burned and nothing will remain except ashes. And of course, it is single-use procedure. Method again is very good to destroy something, but of course you cannot sterilize instruments with the help of that method, because they will again burn. Temperature is very high. So that method is good for destruction of biological wastes and some bandages and tissues, again, maybe clothes or dead animals, sometimes dead after some serious infection and dangerous. But again, use of that method is limited only to destruction. So method is usually used in some industries. It is uh, dangerous and expensive method, because it is requires specific oven, very difficult in composition, and again usually it is an industrial type of destruction, and only large and really large hospitals can afford that type of sterilization. Usually hospitals have a contract with some third organization for destruction of biological waste, and they will perform that method. So now we'll talk about some methods which are available in routine practice, and they all are known for you, and you will see it in our laboratories, and those techniques are used in laboratories and hospital and medical settings. First one, again, we're still talking about physical methods with the use of high temperature and dry heat is used. It is heat oven or hot air oven. Different names can be applied for the technique. It is separate device made of metal double walls, and actually it is a closed chamber with heating uh, element and fan. And in that chamber, temperature can be raised up to 200 Celsius, 200 degrees Celsius, and according to complexity of instrument, we can use 30 minutes till 2 hours duration of sterilization procedure, and it is a dry heat. We can easily sterilize different glassware, metal instruments, cotton swabs, some types of powders. They will not wet, they will not change their structure. And that method is highly available in any laboratory. The only penalty of that method, it is used a lot of electricity, it is consuming a lot of powers, and of course uh, it can be pretty expensive if energy costs a lot in some countries, but in general devices are kind of cheap. Use is very simple. So we have different, again, modifications of devices with pre-programmed temperature. Only few buttons are available. You can only choose pre-specified regimen. Or in modern devices, in complex devices, we have touch screens, and you can adjust any parameter manually. You can adjust time, you can adjust temperature, you can adjust different even regimens. Some, it can be not fixed temperature, it can be uh, modified temperature. And of course, method is simple and used in laboratories, again in medical settings both. So still physical methods with the use of high temperature, but not now. We will talk about moist heat. Means some wet is present in air during those sterilization techniques. So here in the picture, it is one of the most known sterilization techniques known as pasteurization. It is a device for pasteurization of milk, but actually we have the same for different vaccines, for different uh, other milk products, for serum, and according to purpose of the device, it can be smaller, it can be much bigger. And again, and nowadays we have multiple modification of pasteurization. In classic manner pasteurization is heating of a liquid up to 63 degrees Celsius for 30 minutes. The main idea that pasteurization is used for different complex liquids contain animal or human proteins, again, such as the milk or serum, for example. And you cannot heat that liquid for higher temperature because you will destroy those proteins or some other useful substances present in that liquid. But still, you need to kill bacteria. And we know that main number of bacteria are mesophilic. They can survive only in the temperature up to 40 degrees Celsius. And uh, heating up to 63 degrees Celsius for longer time period can kill vegetative form of bacteria. But again, classic regimen of pasteurization cannot inactivate spore producing bacteria, cannot kill spores. So again, nowadays we have multiple modifications and we have different regimens of pasteurization prolonged for a day or even for 2 days, when bacteria is allowed, spore is allowed to germinate, and then liquid is heated. And multiple different regimens according to purpose, according to area of its use. But still, pasteurization is one of the most popular types of sterilization of food products. Next method is highly known for you. It is again one of the most simple and primitive methods known for centuries. It is boiling. It is simple heating of liquid product until 100 degrees Celsius for 10 to 30 minutes. And boiling is highly used in common life for sterilization of food products. When we boil in something, some meat or vegetables, of course, one of the purpose is to cook that product to make it softer and more adapted to our GIT. But the second purpose is to kill bacteria and kill some microorganisms which can present here. So if you talk about use of boiling in medical practice, boiling is used to sterilize clothes, bandages, some glass dishes, and rarely, but it is used. And of course, you all know that boiling of lab coats, for example, or medical coats, is still used in surgery, for example. Some material which is used to cover the subject, to cover the wound or some other purposes. Of course, even bed clothes should be sterilized, and it is still sterilizing by boiling. Next method is more complex. It is autoclaving. It is again method with the use of high temperature and moist heat. Autoclave, it is one of the most known devices in medical practice and laboratory practice, and it is in classic way. It is looking like a shining tube, metal tube, and multiple tabs are here. And autoclave is connected, or water supply is adjusted to autoclave and one tube to release steam and surrounding air. So autoclave have several regimens of work, and it can work as a boiler when simple heating of water up to 100 degrees Celsius occur. And usually autoclave when no pressure regimen is used to sterilize different types of culture medium. And of course, the main benefit of autoclave, it can be closed, it's made of very thick metal lamins, and it can rise pressure significantly. And of course, if you remember physics, boiling temperature of water depends on pressure, surrounding pressure. And if pressure will be raised, temperature of water boiling will rise as well. So with the help of autoclave, we can rise the temperature up to temperature of water up to 147 degrees Celsius. And of course, the temperature is sufficient to kill not only bacteria and fungus and some vegetative forms of microorganisms. It is sufficient to kill even spores. And still, as far as it is moist heat, we cannot sterilize some medical surgical instruments, but it is good for sterilization of bandages, for sterilization of some metal instruments, such as the same forceps, for example, and some types of glass. And autoclaves, we have several in our laboratory. We will show how it is working. We will show you its structure, and you will see it in by your own eyes, according to purpose and according to number of instruments which should be sterilized. Autoclaves can be of very different size. It can be small as a simple boiler which is used to boil water in some even at home, and it can be very big and serious device as is shown in the right part of the picture. It is a complex device with again built-in computer, and multiple parameters can be adjusted, and you can adjust pressure, you can adjust time regimen, you can perform multiple steps, sterilization, and of course they can be very complex and very large in size. So now we need to talk about non-temperature methods of sterilization, and again it is anyway familiar for you. Mechanical filtration, it is a method with the use of membrane filters with known diameter of pores which can hold bacteria mechanically. And of course we have different types of filters. It is a simple water filter which can be again very simple and primitive, used only for drinking purpose. It can be as is shown in the right upper part of the slide. It is a complex system of filters, which is a flat type, means it is uh, put it in, it is placed for the whole flat. It can filtrate water, which is supplied to your tap in your house or home. And of course, we have manufactured filtration systems which are used in, for example, in hospitals to clean the water for the whole hospital, or in different laboratories and manufacturers who deals with production of sterile liquids. And of course, you all know that filters can be used not only to remove everything from water. Filters can be used, and they are widely used, to separate different particles in water. For example, we can separate bacteria and virus. If you grow in bacteriophage in the culture of bacteria, we can easily split them by use of filters with the size of pore, which will hold bacteria but let virus allow virus to pass. We can use filters to increase concentration of bacteria. So you can take some liquid, for example, nutrient broth, grow bacteria, filtrate broth, add new, and bacteria will be held by filter. It will present a much higher amount if you will grow it again. And filters are used to separate bacteria and bacterial toxins. If you need, for example, to produce anatoxin or antitoxic serum, of course, you need to separate toxin and bacteria which is producing the toxin. And again, filters can be used for that purpose. Of course, you all know that, yeah, that is a few example of synthetic filters. They're made of cellulose. They have known diameter of pores. They use for filtration of water. When we talk in previous lectures about membrane filter method to study quality of water, it is a filter here shown which is used for filtration of water with the help of that glass can. And of course, filters are widely used for sterilization of air. And nowadays, thanks to that COVID pandemic, mask became the most popular filter. And of course, everyone wearing the mask with only one purpose: to hold viruses, to hold bacteria. But air can pass through that filter. We can breathe with the air, but we can breathe safely. And of course, we have filters for air ventilation systems. That is shown in the right part of the picture. It is filter which is built in air ventilation system of hospitals, and they can filtrate air which is put in the hospital from the street, or in every ward that filter is put to hold bacteria which is exhaled by patients, exhaled by medical staff. And mechanical filtration is again very popular and very available method to filtrate liquids, to filtrate gases, and even some types of powders can be filtrated with the help of corresponding filters. Another method of sterilization, it is a radiation. It is a physical method which is using different types of radiation. And as you know, radiation is classified into two types: non-ionizing and ionizing. And of course, both are used in medical practice. And in that slide, we have non-ionizing radiation, such as ultraviolet and infrared, UV and IR lamps, and even chambers. Of course, that method is one of the most popular for sterilization of surfaces. We can put the lamp as is shown in the left picture. It is a lamp which can be put on the surface of the table, on the floor. We're using those lamps in laboratories to sterilize the whole room. And similar principle, UV lamp, it is provided, photo of that lamp is provided in the center of the slide. It is similar device, but using infrared lamp. It is using heating of surfaces of objects, but of course that method is less used because not every surface can be heated up to high temperature. Usually it is limited to some walls and some surfaces made of stones. But if it is some wood-made table or it is some type of plastic, of course it cannot be sterilized. And you all know, you all saw those chambers, UV chambers. They are very popular, especially in some surgeries and in dental practice. They have smaller chambers. We can use um, big chambers with the multiple floors. And of course, radiation is safe for surface of the metal. It will not change its property. And UV chambers and UV lamps are highly used for sterilization of syringes, especially and again in dental practice when some complex and structured syringes are used for multiple times. Different catheters, different types of plastics, which cannot uh, be sterilized with the help of the temperature. They're afraid of temperature. They can be deformed or destroyed by temperature. We can easily use UV and IR chambers and lamps. And of course, if we said that we have ionizing radiation is used in sterilization procedures as well. So the main, of course, penalty of that method is high danger to medical staff and to people who using that method. And of course, ionizing radiation is not used in routine hospital settings. It is manufactured technique, and usually only high manufacturers using those ionizing techniques to sterilize high big loads of different medical instruments, syringes, different plastics, swabs, oils, and even food products nowadays are mainly sterilized by ionizing radiation. That's why it is possible to have those different ultra pack, tetra pack, and other packs when product is hermetically closed with its pack, and it can have very long duration of storage period, some months. Previous years it was not possible because we used other sterilization techniques, and usually uh, they were performed before closing the volume, some barrel or other. And of course, some bacteria from air had a chance to invade in that product, and that's why storage duration period was much shorter. And nowadays, we can easily first close the pack, then sterilize it, and it will remain sterile for much longer time period. And in that photo, it is a chamber with the use of cobalt 60. If you can see, it is a brick walls, and those blue color lamps they made in the roof of the room, and it is a large room, several uh, meters square in area, and that room can be completely filled in with some devices, equipment, and lamps are turned on, and gamma rays will perform destruction of any viable form in food product or in some medical device. Of course, we have X-ray chambers, which are more available, more simple, and less expensive. But again, they usually used only by manufacturers and by some uh, large facilities, and they can be used again in food industry, in medical industry, and it is easy to use. But again, you can see in the slide it is a chamber like metal, big metal chamber. Of course, that method is highly dangerous. First of all, it is dangerous for staff who is dealing with it. Of course, it is a specific requirements and very strict requirements for uh, that facility. It should have protected walls. It should have, if it have protected windows made of specific metals addition. And of course, metal is expensive. And routine hospitals, that metal is not available. It is used only for large um, settings for sterilization of large amount of different products, and usually only manufacturers can support that type of sterilization. They should provide, of course, restricted access to that area. It should be secured, and again, for hospitals, that method is not allowed. It's not suitable, but in manufacturers, yes, it is highly used. So we talk about high temperature, about physical methods with the use of high temperature. But of course, we should not forget that we have low temperature as well. And again, one of the most popular methods, it is simple freezer. We can put different type of products, again, food products. We can store and sterilize some medicals, some drugs with the help of low temperature, with the help of the freezing. It is a temperature of minus 20 degrees Celsius. In routine settings in our houses, we all have freezers to store and to sterilize food products. Of course, I hope you all understand how physical methods works, how high temperature can destroy alive organisms, that radiation, ionizing and non-ionizing, is targeted against DNA. They can destroy different bonds in DNA material, then organism became not viable. And freezing, again, it is simple physics. Any cell have water dissolved in cytoplasm, for example, or in other organelles. And when you will put that organism into the freezer, water became crystallized, and those crystals will uh, make multiple punctures in the cell wall and the cell membrane. And when you will unfreeze product, water will easily leak through those holes, and a live organism became destroyed. But here we should remember that we have viruses, and viruses have absolutely no water, and that's why viruses cannot be destroyed by freezing, and they prefer cold temperatures. It is not possible to prevent viral infections by freezing. And again, you all noticed, I hope, that viral infections are mainly uh, prevail in winter time period when temperature is much colder, because that cold temperature can suppress bacteria, fungus, and protozoa, but viruses can easily tolerate low temperatures, and they can survive even in some minus 70 degrees Celsius. They're not afraid of freezing at all because water is absent in their structure. And one more method, it is known as noxalizing, and the company originator of that idea, it is known as noxalizer. It is a method of freezing with the help of nitrogen dioxide. It is used of liquid nitrogen, and that technique allows to decrease temperature up to minus 30 degrees Celsius. And of course, as you can see, some types of instruments which are afraid of high temperature can be easily sterilized with the help of that freezing or oxidizing. But again, method is not so popular. It requires liquid nitrogen, and of course, it is more dangerous technique. It is complex. It requires specifically trained staff, and usually that method is used only in very large laboratories, big hospitals, or uh, that method is used by manufacturers of some different medical equipment. And of course, we said about chemical method. You all know multiple types of chemicals. Usually they're based on alcohol. Alcohol is safe. Itself is used as an it came with different concentrations, 70 and 96. Usually, it came with different substances, gel, liquid, or sprays and topical solutions. Of course, it is one of the most popular uh, disinfective solutions and antiseptics as well. And besides liquid chemicals, we as well have gas chemicals. So on that photo, it is a chamber for sterilization with the help of ethylene oxide. And again, it is dangerous method. It is harmful for personnel. It requires specific safety requirements. It needs specific safety requirements, and of course, it is usually used by manufacturers. But gases are very good for sterilization of porous materials and some types of plastics. Again, such devices, complex devices as endoscopes, some medical complex devices which cannot be sterilized by heating, they're made of multiple different plastics, metals, rubbers, and they cannot be sterilized by liquids because they have multiple pores and multiple empty cavities inside. But they can be easily sterilized with the gases. Gas can easily invade in any cavity, any pore, and after that it can be easily dissolved when instrument will be extracted from the chamber. But again, method is limited in use because of price and because of complexity of procedure. So in laboratories and routine laboratories, it is always required to monitor if sterilization procedure was performed correctly or not. Because if device will be broken, some hidden element is broken, or some uh, other electron system is broken, some micro scheme or other. Of course, sterilization procedure can go incompletely, and in that way your instrument will still be contaminated with microorganisms. So of course we need to be sure that instrument is sterile, that nothing is present in that instrument, and we can safely use it for our medical procedure, our surgery, or some other. And of course we have different methods of control of sterilization. One of the most simple, the most known, and the most primitive method is use of indicator paper strips. They are shown in the left part of that slide. So you can see multiple different strips, and they all have two dots of different colors. So in every strip it is shown temperature in degrees Celsius and time period. For example, some 120 degrees Celsius, 10 minutes. It means that if sterilization procedure will be performed correctly and we need to sterilize something for 120 degrees Celsius for 10 minutes, we need to choose appropriate paper strip and put it in autoclave or in some hot air oven. Put that strip together with your instruments or some dishes. And initially, dots are of different colors. And if your sterilization procedure will go correctly, then after you will extract that strip after sterilization, both dots should become equal in color. If it is happened, it means that temperature and time were correct and your sterilization procedure went perfectly. If color is not changed or it is different, it means that something went wrong and sterilization procedure was incomplete and you cannot use that instrument. You should check your device and perform sterilization procedure for those instruments again. Similar method we have thermocapsules or thermocouples. They are shown in the right part of the slide. It is a tube, simple test tube with some powder or some substance added into that test tube. And again, initially they have one color. After sterilization, if sterilization will be correct, they will change the color according to instruction. Method again is simple, cheap, easy to use, but of course, in nowadays we're trying to make everything more simple, and we should have documented procedure. We cannot keep all those strips, use strips. It's not reasonable, but we should have some confirmation we can show to everyone that sterilization procedure was correct. And of course, in nowadays, I will turn back to the picture. I already showed you that autoclave, but please take a look at the right lower corner of the device. We can see that it is a paper check printed here, and it's looking like a simple bill. It is a paper where all parameters of sterilization are shown, and device can monitor modern devices. They of course have built-in computers, they have multiple detectors, they can print your complete graphic of or complete graph of sterilization in which time point, which temperature was detected by the device. And of course, it is more suitable measure because you can take that printed bill and uh, keep it for any purpose you need. If any check will come, you can open specific book and you can show in which time period which devices were sterilized. You will show that all procedures were correct, time was correct, and temperature was correct in every time point of the sterilization procedure. Temperature was high enough and you perform all correctly. And of course, almost every modern devices are equipped with computers and even some printers. If it is not a printer, then it is some USB port. You can connect USB flash driver or connect it to other computer. And of course, we can download any information you need and print in any suitable format or store it as PDF file. Of course, nowadays it's much more easier.